Okay, operate. What is this? Operation is locked. Rotate. Jeez. Okay. Here we go. Okay, we're live. Hey, everybody. Had to get the daughter situated for school, so now we can chat. We can talk. And we got the live thing. Calabrese 007 has a little wondering face as to like where I'm at. It's okay. Um, it's YouTube. Uh, I don't have a set schedule when I'm doing the YouTube thingy. Oh, okay, come here. Come on, we gotta get questions. It out questions. That's what I did. Okay, here we go. Good morning, everybody. It's Bill, the Knee Pain Guru. If you got questions, type those in the live chat. We'll get to those in just a minute. Make sure to give the video a thumbs up, like and subscribe to the channel. Turn on notifications for future videos. So we got a little bit of a hodgepodge today as far as questions, as they were kind of, I've been doing these videos over the past week or so, couple weeks, and it's such a, gosh, I'll tell you what, pain makes things so confusing. It'll take, I've been able to distill it down into real simple concepts that if you follow the simple concepts, you get out of pain. And I'm seeing how convoluted things can be when pain comes into the equation. It's like, oh, should I do exercise? Should I stretch? Should I rest? Should I ice? Should I do ibuprofen? Should I? And it gets you in this hamster wheel loop that just makes it more and more difficult, and a lot of times you end up digging a hole deeper for yourself because of that confusion, because of what pain does and how it changes your mind, how it changes your emotions, how it changes your physical body. And until you begin to accept that piece, you're going to be on that hamster wheel. So with that being said, I'm going to turn the camera around. We're going to talk about one of these questions here. Let's see. Let me turn it around. Okay. Question here from Jamia Brewer. So after a year of ACL reconstruction and second surgery, still no range of motion gain. What is next? Well, depends on what you want to do. This is your world. Understand. You make the choices in your life as to how you want to proceed. The conventional medical model is going to give you more of the same. Drugs, shots, surgery, painful physical therapy. That's the model. Understand that. Accept that. There was another question here. Did I print it out? Oh, yeah, there was someone that was had typed in a question that I responded to in person, and they were like, "Well, I wish the doctors would talk about this stuff that you're talking about on these videos." And understand that mentality is part of the problem. That mentality is part of disempowering you, thinking someone else is going to do it for you. Like the doctors are suddenly going to show up. They already have a lucrative business model that works. Why would they change? Who's going to change? You got to change. Otherwise, you're going to get more of the same, and you're going to continue to get let down. It's like being pissed off at a tree for being a tree. Why? It's a tree. You could walk away at any point in time and do what you want to get your knee better. I'm offering a different option for you. Whether you choose to pick it up or not is completely up to you. It's your choice. if you want to continue to be a victim of a situation, of situations you can't control. The medical model, what's going on in your knee, oh, there's nothing I can do, I'm so confused, I'm so overwhelmed. Or you want to go in another direction where it's like, oh, this is how my body works. And if I do these things, I'm going to get these bad results that I don't want. Or if I do these other things, which requires you to look at your body in a different way. You look at your body in a different way, you're going to get different results. You continue to do the things that don't work, well, guess what? The only person you can be pissed off at is yourself. That's why I get some thumbs down on these videos, because people don't want to hear that. People don't want to hear that they need to take responsibility for the outcomes for what's going on with their knees. My parents' generation, big time with that. Go to the doctor. The doctor knows best. They'll cut the bones off in my leg and replace it with plastic and metal. There's nothing I can do. That's just what happens when you get older. You'll know. That's just what happens. You're getting older. You can't change that. Horse shit. Anyways, next question. Question here from BigThirsty. It says, is my hamstring tight? With an exclamation point. So I'm not really sure if that's a question or not. So when I lie down or bend down, my legs and lower back hurts. Also when I walk or run, I feel fatigue. Yes, that's what happens. When the knee gets injured, the body compensates. I want to say it again because this is huge. And this is why the knee may not hurt, then other areas begin to compensate for what's going on. When you injure your knee, what ends up happening? You bend your knee, which requires you to tighten up your hamstring, and you pull your hip up on the side of the injured knee. Makes your legs short, your hamstring tight, your lower back tight. You shift the weight over to your other leg, which causes the hip and the knee on the other side to take an unbalanced amount of pressure and force. And it's going to show up in your shoes. It's going to show up in how you walk. It's going to show up in the wear pattern of your shoes. So, yeah, the hamstrings get tight. And here's the thing. Everybody's body feels differently. Everyone's body feels differently. The tension from your head to your feet manifests in your body. The weakest link in the series of tension from the head to the feet is what hurts. And for all intents and purposes, the people that are listening to this channel have pain in their knees, which means their knees are the weakest link in the series of tension from the head to the feet. Other people have hip pain. Other people have back pain. Other people have neck pain or shoulder pain or plantar fasciitis or shin splints or calf pain or tight hamstrings or. It doesn't matter what hurts. What's important is to understand the larger pattern that's going on in the body. Otherwise, you're just a victim of what's going on. Make sense? Enter your questions in the live chat. You don't have to be afraid. I can be intense at times. I get that. I understand that. However, what I want is for you to get this. I want to empower you. There's too many people that default to victim. Too many people that default to, oh, I can't do this. I was just working with my daughter this morning. She wanted me to send a text to her teacher to do something. And I'm big on, if there's something that you can't do, I will be happy to do it for you. But if there's something you can do, I'm not going to reinforce your victim status. And that's what I do with my daughter. If there's something that she can do, I will not do it for her, because that reinforces her that she's disempowered, that she can't do it, that she needs someone else. She needs to rely on someone else to do it. That isn't fair to her. When I'm not around anymore, what is she going to do? Same thing with you. If there is something that can empower you to help you with your own knee pain, I'll absolutely share it with you. I'll absolutely help you with that. But if it's going to reinforce a pattern that keeps you a victim, you're in the wrong place. That's just how it is. Okay, one more question here. If you got questions over, type those in the live chat. If you like the video, give it a thumbs up. Like and subscribe to the channel. Turn on notifications for future videos. You want to know, and here's another thing. I get a lot of people are like, well, how do I do this? I'll shift your mind. How do I get my knee out of pain? How do I loosen up my tight hamstrings? How do I bend my knee more? This channel is to help you change your mindset to empower you. Empower you with the knowledge and understanding of how your body works differently. Your mindset needs to shift. If you want to take action, a lot of people will not take action. Oh, that's great. That's good, Bill. They don't take action. That's why I have a group coaching program called Knee Club. I'll tell you about that in just a minute. Okay, next question here. Next question is from Mr. Todd. I had a knee replacement about 2 years ago. I'm still trying to bend my knee so my ankle touches my butt. Is that possible? If so, can I get there? Okay. From my understanding, your knee, once you have a knee replacement, will never touch your butt again because of the limitations of the knee replacement. That's what I've been told. I've had a lot of buddies who have had knee replacement surgeries. My father has had a knee replacement surgery. So there's this place that that's the reality of it. Now, many times the joint after a knee replacement is limited not by the knee replacement, it's limited by the tension in the joint or scar tissue to build up in the joint. So if the knee replacement can get to 90 degrees, a lot of times people after having knee replacement surgery can't even get close to 90 degrees. So that's a different conversation. That is, how can we address the tension in the knee joint as well as in the hips, in the hips and lower back, that will get you to the range of motion that will then be limited by the knee replacement. So you can see the level of complication, the level of challenge in range of motion in a knee goes up infinitely once you have a knee replacement, which is why I like to educate more people to realize that they don't need, many times they don't need to have a knee replacement, and that getting a knee replacement will create more difficulties in what's going on in their body. And in some cases, knee replacements, like I talked to a guy one time, he was 88, and he was actually falling down. Like his leg was collapsing because he had completely severed the ligaments. Completely severed the ligaments in his knee. So his knee, it wasn't attached, and he'd move a certain way. And then the knee replacement is definitely better, because now you're talking about a gentleman that's 88 that can fall and break his hip, and that, it just escalates from there. So you have to take your situation into consideration. Now the guy or the person who's in their 40s, that they have pain, or limited range of motion in their knee that is told they have arthritis and is a perfect candidate for a knee replacement, there's no need. They can easily eliminate all the pain and regain the full range of motion in the knee joint. Knee replacement isn't even in the conversation. So, and it all depends on what you do, like your process. You want to go the conventional medical route, that's great. I offer a different approach that works with people remotely. I have clients around the world. 6 continents, and I know that sounds fancy. However, I had the knee club call yesterday. We had 3 people from Britain. We had 1 from Africa, 1 from New York City, 1 from California, somebody from Minnesota. So it's like you have the issue of what's going on. You tell me where it hurts in your knee or in your hips or lower back. I'm giving you specific videos that are actionable, that you could begin working with today, to begin to implement and get results today. And because we're working with the neurology of the body, the reflexes, the speed of the reflexes, which fire at 286 miles per hour, you begin to get results. Your neurology begins to change. So instead of fighting your body to force the range of motion in the knee, you get the joint to relax. When the joint relaxes, it allows range of motion to happen. It allows for comfort to be created. It allows for the joint to move and the breakdown of scar tissue to be easier because you're not fighting the neurology to get it to do so. So, that's it. That's what I got. No questions. That's okay. I'm going to scoot and get other things I can work on. Okie doke. So, give the video a thumbs up, like, and subscribe to the channel. Turn on notifications for future videos. For those that give these videos a thumbs down, I challenge you. I challenge you to write in the comments section what you don't like about the video. Because I'll call bullshit on whatever you're challenging me on. And I will. I don't have a problem with it. Because most of the time, I did a top 10 reasons why physical therapy is making your knee pain worse. I had physical therapists telling me, yeah, you're right. Doctors can't challenge me on what I'm offering because it doesn't fall in their purview. It's not their area of expertise. They don't understand the neurology, the nervous system. They haven't studied what I've studied. So the people that give the videos a thumbs down, and I'm using it as a way of conversation because people who give thumbs up are in agreement with me. I'm challenging their belief systems. Thumbs down are given to you by doctors and pharmacy reps. Yeah, maybe. Could be. Anyways, yeah. So I challenge the people who give me thumbs down to give me the reason why. I'd like to hear it. It would give me great topics to talk about on the next videos. Like what to do. Here's your action steps after here. 3 things. 3 things you could do. You want more information. You want actual help, not just like giving the video a thumbs up is like a nice thing as far as the YouTube algorithm goes. But 1 is you can set up a time to talk with me. And we'll talk about your situation. That's 1 thing you could do. 2 is sign up for Knee Club, this group coaching program. You can get actual help that I will guide you and direct you to exactly what you can do to relieve the pain in your knees to increase the range of motion. Or 3, I have a private coaching programs. Up to you. Whatever you want to do. Or you can keep suffering. I suppose that's 4. Anyhow, that's what I got. Thank you for your time. Bill Paravano, the knee pain guru. Gonna sign off for today. Have a wonderful day. I'll see you on the next one.